All right, lovely. Hi, everyone. So today I've got the honor of interviewing a friend, a colleague, Rakel, who is a mental health practitioner and an ADHD and autism assessor. Hello, Rakel. How are you doing?
Hi, Shola. I'm good. Thank you very much.
Good, good. Raquel, please tell us a little bit about yourself. Tell us your current role. What role are you currently doing?
So, my name is Rakel. I currently work in quite a few roles. I assess children with autism and ADHD. I am a mental health practitioner. Sometimes I work within the crisis team. I do like crisis line. I do telephone triage for people in distress, in crisis. I can, and I also, as you know, work as a CHC nurse assessor.
That's really good. That's really good.
And I'm a
So
mom. I make
you're also
cakes.
a mom and you're a baker as well.
My baking side is when I really chill because, as you know, mental health as a practice can be mentally draining sometimes.
It can be very challenging. So Raquel, are you actually a mental health nurse or LD nurse?
So I actually qualified. My qualification is a learning disability nurse, and I remember it was only 15 of us in our cohort, and people were always saying, "Are you guys ever gonna get a job? Would you have a job?" And that was always a worry. But I personally don't worry about anything. I actually wait till I get there and see. Because I have one belief that you can always, if you have a good interpersonal skills, you can always use your skills in different places. I'm a learning disability nurse, but I haven't since I qualified up until now that I assess children with autism, which is part of LD nursing. I've always worked in mental health services.
And that's one of the things that people often fail to understand, that an LD nurse is very versatile and diverse. I mean, even myself, I'm a mental health nurse, but my experience actually working with individuals with learning disability and maybe some mental health issues within the CAMS area. And I don't think my qualification of mental health stopped me from being able to get that role. And also, it didn't stop me from thriving within that role. So, most of the time, mental health and LD are very, very interlinked, and it's something that people often don't understand. I think LD nursing is one of those underrated areas of nursing.
I
I
was
think
just
it's
gonna say, please
yeah,
don't say we're interrelated with RMN. We are specialist nurses. A learning
yeah.
disability nurse is a specialist nurse, and I didn't appreciate that until I graduated.
Wow. So you guys are specialists in your own area. Fantastic. I mean, I think for this interview, the area that I really want to focus on is the area of autism and ADHD. So, when you're doing your assessment for individuals with autism and ADHD, what are some of the things that you look at? What are the age criterias? What are some of the things that you look at when you're doing your assessment?
So, in terms of assessment, some people go through their young age, not wanting to know or not even knowing, and they get to the adult age, adulthood, and they want to know. I mean, we all know that years back, I'm sure it wasn't a thing as popular as it is now. But I work within, child and young adolescent service, so children's services, and I do assess children with autism and ADHD. Generally, the best ideal time is usually school aged kids. So, unfortunately, with COVID that happened in the past, there is about 24 months wait from the time somebody comes into the service or is referred into the service. Sometimes it is the parents that would pick up, oh, my child is behaving a little bit different to other kids at parties, maybe their cousins, or my second child is behaving different from my first child. So some people then make a self referral, others don't, because a lot of us, we are in denial. It is when the child starts, nursery or reception or school, the school picks it up and then they advise the parents to make a referral. Generally, we assess from the ages of 6 upwards. And part of what we do ask for, which is very important, is developmental history. Is about the child at birth. We even go back to asking the parent about the pregnancy. How was the pregnancy? How were you? What happened during birth and childbirth and the child growing up? Did they meet all their milestones? Did they talk on time? Did they speak? How are they in interacting with other children? Two children can stay beside each other and be playing alongside but not playing together. So is generally in children with autism, you would say a child with autism, there's specific traits like, there won't be any face gestures, like they might not smile at birth. Maybe when they're now growing up, they don't reach out, reach their hands up to their parents to pick them up. So these are questions we ask. So if anyone is on the waiting list or wanting to go on the waiting list, it will be nice for them to have like a diary to write down things that they notice. Nothing is less important. Everything is important. We ask everything. We ask about family history. We look at who and how the child even eats. What do they eat? What are some of their behaviors? Do they have repetitive behaviors? When most children watch children's program, do you think your child repeats particular phrases rather than talking in sentences? Does your child just is happy just playing by themselves rather than playing with other children? These are all the things we look at. We ask about, importantly, the child, and then we look at them growing up through school. Are they having difficulty making friends? Do they understand empathy? Do they understand sarcasm? If their friend is upset, do they know what to do? You'll be surprised. It will be these things. Are they able to keep friendship? How are they? Do they compromise? Is it always my way or no way? Do they have set toys that they lay in a set way, whereby if somebody moves one of the toys, they know, and it upsets them? How is the child with routine? If usually, I don't know, we go through the back road to school and suddenly there's roadworks on the back road, we've decided to use another route to school. How is the child going to accept that? How is this child in terms of sensory? Are they, are they, is it usually, how do they cope in lighting? How do they cope with noise? Some children, they would have to wear, ear defenders. Some children are not able to sit down still for so long. How are they in class?
Yeah, no, that's really good. From a layman's perspective, because I know that LD is an area that most people do not understand. From a layman's perspective, what is the difference between learning disability, learning difficulties, autism, and ADHD? Just give us a bit of a summary, because I think it's really important that we understand these things.
So generally, people, interuse learning disabilities and learning difficulties. Learning difficulty is when a child has difficulty learning.
Yeah.
Kind of like, it could be something like dyslexia. Things like that will be learning difficulty. It's not like they cannot learn, but they have difficulty to learn, and it might take them a little bit longer. But a child with a learning disability is, it is a condition that they are born with, is a disorder that, and they have, specific issues in terms of, it could be, it could be associated with things like global developmental delay. There are some other things that generally comes with a child with a learning disability. It is difficult for them in terms of coordination, spoken, they might have difficulty communicating verbally. You might have to start thinking of, providing other alternatives for them to be able to communicate with other people. They could have issues with, with like direct attention. They might not be able to pay attention when people are talking to them. And you might have to actually face the child, call the child's name, make sure they understand, and ask them to repeat it back to them. Again, a child with a learning disability, a child is born with it. It's not something that is developed over time, which is why we always ask for history from birth. Autism is a neurodevelopmental disorder. It's something that, children who have autism generally, have issues with social interaction. They have issues with like behavior. They're not able to understand a few things. And when we talk about ADHD, which is attention deficit hyperactivity disorder, we have children who generally, they don't have a long attention span. They're not able to sit still for so long on an activity. They might have to take regular breaks in class. So it's important that the school understand how to support that child. They might, their impulsivity is always there. So a child with, or a young person with ADHD will probably just get to the road and cross the road. They won't think, oh, let me look right and left, there's traffic. Even at the age of like 9, 10 years old, they will not think of, let me wait. You all could just be sitting down watching a movie. They just stand up and maybe just flick the light switch. They're not able to sit still.
Yeah.
And it is not, that they're being naughty. It is not being a naughty child. They just cannot help themselves. And, focus is another thing. You find it really difficult to sit through an activity and focus for a long time, especially when it's something they don't really enjoy. Children with ADHD usually, they excel in activities that, involves doing things, movement, like
Yeah.
PE, going to the gym, activities that they can burn energy. But when you put a child with ADHD in a room, asking them to do art coloring or read a book, you failed the
Yeah.
child.
That's really good. And one of the things that you said that was very important is that, if they're getting up and they're flicking the switch and they're doing things, it's not that they're naughty. It's just that they're trying to deal with, what's going on at the time. Maybe
Yeah,
it's taking too long, they're sitting for too long and they need a change. No,
yeah.
that's really good. So one of the things I want to discuss is I want to look at the interventions for maybe somebody with autism or somebody with ADHD. I want you to talk about the psychotropic interventions and the non-psychotropic interventions such as the talk therapy and so on and so forth.
Yeah, so I was just going to give an example in terms of, these conditions. It's kind of like if you have a toothache and you don't deal with it, the toothache is never going to go away. I get it. I'm an African, I'm a Christian, we pray. But I also say God has given us these physicians, this psychiatrists, and giving us this medication to help with the conditions we have. So it is important if you think your child or somebody might be showing traits of autism or something is not right, speak to your GP. Don't be scared that they're going to label my child. No, you're getting that child the help they require to achieve their lifelong goal. So again, in terms of when it comes to autism, I've had a child say to me, when you and I look at a field, a field with just grass, we see a field. That child told me he sees every individual green leaf on that field. Does not matter how big the field is. So, you think, oh, this child, I'm talking to this child, they're not listening, is because their brain is not switching off. Constantly is working and is kind of like they're on overdrive. With autism, unfortunately, there is no direct medication for autism. Autism, generally, a child with autism has specific things that is causing them anxiety, and it's about managing it. So, as an example, a child with autism, some children, you might have difficulty getting them to school or them going to a mainstream school. And it's because the class is probably too overloaded for them. The sensory overload is too much. They just cannot deal with that noise. Again, I've got a daughter. She hasn't got autism. She's not diagnosed, but I noticed some particular noises. She goes, Mom, what's that? What's that noise? I have to explain to her. It causes her anxiety. And that is the same with a child with autism will hear every tiny noise. A noise that you and I would not hear, maybe like from the third street to my house, a child with autism will hear. So imagine the kind of noise we have in the school environment. So every time that child is thinking, oh, I'm going back to school again tomorrow, and the noise is ringing in that child's ear, like it's just so loud, it's really amplified. You and I think, oh, come on, it's just a school noise. Yeah, to me and to you. But a child with autism is not just a school noise. It is a noise that is just constantly ringing in that child's head that the child cannot focus on anything else but that noise. So it is important to be able to support that child. That child might need to go to a specialist school where there's only 6 people in a class, or go to a mainstream school, but with support. They might always bring the child might be, I don't know, be in a separate class with an adult that can teach that child rather than being in the generic classroom. Or with supports, the child might be able to cope in school by, sometimes we talk to the school and give them some strategies like letting the child be able to go out of class to let off steam, rather than he's not comfortable, he's sitting down, he's flicking papers, his legs are shaking, he's not able to leave. He's not learning anything anyway. You might as well let us know that, okay, miss, this young person needs support. When he starts to feel like this, he knows he only needs to show his teacher his card, and the teacher will let him go out to let off some of the steam or the energy in him. With ADHD, there are medication. Again, when it comes to prescribing, I don't prescribe medication, but from feedback that we have had from parents, the medication does not stop the ADHD. It only works generally during school, 6 hours of school, to help with a child to be able to focus in class. Again, medication has its side effects. And because we're all human, we're wired differently. A medication can work well for you, might not work well for me. I've heard some parents say the medication zombifies their children. Their children has totally changed. They don't see any charisma in them anymore. They don't see any fun side in them. If, so whether or not to take medication for ADHD, it is dependent on the family. But I'll just advocate and advise you make your own research in terms of medication before you start. But autism, there really isn't any much medication, except the child is so anxious that day-to-day activities, they can't even leave the house to go to the shop. They cannot leave their house. Then we can now start looking at medication to help with their anxiety, or therapy to talk about what is causing them anxiety.
I mean, I think that's really really good in terms of what you've discussed so far. I also know that you're also a CBT therapist. Can you just give us a snippet of that? Tell us about what that involves and what that entails.
So again, in terms of CBT, oh, Mr. Shola, come on, you're just getting on my brain. You're really, really putting me on the spot. But
I'm
it's in terms,
sorry. It just
it's
shows that I've done my research.
it shows that I personally am so passionate about supporting people. I'm passionate about people knowing, because once you know, you're able to then make that informed decision. But how can you make an informed decision if you have no idea that there's a problem or this is how to get a solution? So, in terms of CBT, which is cognitive behavioral therapy, it helps us, change the way we think about things to reduce the issues we're having. I'll give an example. I don't like flying. I've always had anxiety around flying, but I've been able to use my CBT skills to help me. The same advice I give patients, I've been able to say it to myself. I look at myself and I don't think of what is causing me the anxiety. I know what is causing me is being on an aeroplane, which I don't have control over. Well, I'm not a pilot and I don't know how to fly a plane. So I have to accept that somebody is taking ownership of that plane. He's going to drive me to my destination safe. So I no longer think of that journey. I think of where I'm going. I'm thinking of the fun activities I'm going to do. I'm thinking of the lovely pictures and how I'm going to get back and post those pictures. So those are my thoughts. Those are what I do when I'm on the plane. Like, it was so bad to the point where I will be so excited. I'll book my holiday. Then the day before or the day of my trip, I'll be thinking, should I just cancel it? Should I just not go? Or when I sit on the plane, my legs are shaking, like my teeth is tittering. I'm like, I'm feeling it. I'm so anxious. But with my CBT, head cap, I've been able to gradually overcome it. And I think flying now is good.
One of the things I like about being a mental health nurse is that I am able to implement some of the things that I've learned in university in my own personal life, things such as the 7-11 breathing, things such as, maybe just CBT theory in terms of the way we think affect the way we feel, the way we feel affect and the way we feel affects the way we act. So that's one of the things that I really like about being a mental health nurse, and also having these trainings which we also deliver to people. One of the things I'm very passionate about is the conversation of learning difficulties, learning disability among the Black and ethnic minority community. And also, some of us are religious, some of us perceive these things as taboo. What are some of the challenges that you face on day-to-day basis with people of ethnic minority and accepting that this is actually a thing?
So it is really funny you ask this, and I think the lot of the charity work I do outside my paid work is really to help our African community. I'm going to be honest. And of course, everyone at large. But again, a lot of African communities, we are so much in denial in everything. If everything is not hunky dory, normal, rosy life, it is a taboo. It is a God forbid. Oh no, God didn't do this. But some things come into our life as a challenge, but it is a blessing, because if that challenge didn't come into our life, we wouldn't think outside our normal, usual box of thinking. I meet a lot of African parents, and I say, I mean, with the little experience I have within my job role, when I see a young person with maybe traits of autism or learning disability or whatever, I can kind of see, and I kind of like, hi, we talk, and I try to say, have you spoken to your GP about XYZ? Oh, there's nothing wrong with my son. Oh, there's nothing wrong with my daughter. I'll leave it there. I don't say anymore, because until somebody's ready, you can't label a child. You cannot make somebody accept that there's a problem when there's no problem. I mean, a friend of mine said to me, she actually told me in confidence, it took her 7 years before she accepted that her son's got autism. After diagnosis, then she went to, pursue a diagnosis. I think she said the health visitor noticed and said to her that, you need to speak to your GP about getting an autism diagnosis. Like, no, 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 don't label my child. Took the child to Africa. Everyone in Africa said, there's nothing wrong with your boy. Don't let them give him a label. Don't let them give him a name, blah, blah, blah. And it took her 7 years. That is 7 years of, that is a time that boy could have been receiving intervention. He could have been having support and all that. And when I talk about other people, this happened to me as well. So my first kids are twins, and my daughter, I remember, of course, I'm not going to say here how I used to be so cross with her, the fact that she couldn't read, so fluently like her twin brother. And I remember when she was studying for her GCSE, she said to me, Mom, I think I have a problem with reading. I said, God forbid, which problem? You're just lazy, go and read. She said nothing. Of course, she got the average mark compared to her twin brother. When she got to uni, she actually did not tell me until she had done the dyslexia assessment. Then she said, Mom, do you know I am dyslexia? I said, what's that? I know. I'm like, what? She said, Mom, I did tell you that I think that I do have issues with studying or reading, but look, it's not a big deal. Now she is getting better grades and higher grades, because now that it has been identified, her university they have been able to create and giving her extra lessons, extra support, a personalized laptop that helps her, and extra time during exam. So parents, African parents, I am also, guilty of this. I don't want to label, but trust me, you're in a country where everything is there for us for free. Please help your children. If you need to, if you think there are concerns, speak to your GP. Why not? It's not going to cost anything. After all, you think there's no problem, speak to your GP.
Oh, that's really good. Thank you very much for that. Finally, what I want to find, what are some of the things that can be done among the African community, among the Black and ethnic minority community, to improve engagement, compliance, maybe openness and transparency? What are some of the things that can be done, and what are some of the facilities that are out there? Maybe charities that are working with ethnic minority. Can you just give us a bit idea of those, please?
Whether there are charities specifically working, with or for ethnic minorities, I don't know. I'll be happy to be part of one. I'll be happy to create one day. I'd love to, but I'm gonna just say that in terms of our African minority, we need to be open. We need to talk about these things. I notice from the little I have been doing, I notice that a lot of Black community have children with a disability, whether it's learning disability, whether it's autism, whether it's ADHD. Do you know what? It's not the end of the road for your child. If nothing, is the beginning of a new chapter, is the beginning of opening something special in that child. It's for me. So I do have a WhatsApp group that somebody added me to for mothers who've got children with autism or special needs kids. A lot of the time, sometimes, every now and again, we can feel depressed. Why me? God, this, God. Well, why not you? I'm going through one or two things in my life as well. Why me? Somebody, it might be a job loss. Some people, they can never hold down a job. Some people is marriage. Some people is children. We always have one challenge in our life that upholds our faith, that tests our faith, is for us to stand strong and be like, you know what, this is not going to beat me. African parents, if you've got a child that, has special needs, I feel is important to, your social skills is important to be able to interact with everyone around you. Don't hide your child away. Don't lock that child away, because one day your child will need to mix with the community. And guess what? They would not know how to behave out there, because you've spent all their young life, when they're meant to be learning how to mingle, you've locked them up. A lot of, I see that a lot. African community, we don't want people to know we've got children with special needs, so we lock them up. So I would say, let's build a community. Let's be more open about this. If there's an issue, speak to your GP. You need to have a good support network, because when you have a child with a disability, on yourself, it can be depressing. Let's be honest. And now, if you isolate yourself from everyone that should support you, you're not even giving that child a good support, because the child will constantly see you upset. The child does not understand. He doesn't know, am I the one causing my mom this upset? Am I the one causing arguments between my mom and my dad? What is happening? The child does not understand. No one's explaining anything to the child, and the child is not being taken out. They don't understand, and it's just, it's a vicious circle. Please, 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 Africans or any, ethnic minorities, if you've got a child with special needs, study what it is. If you know, read up about it, get more information. In terms of charity, I don't know, but I do know that there is help. Speak to your GP. They can always, signpost you to the relevant help in your local authority for that child. There's a lot of support. There are respite services that, your child could go for the weekend so you can have a rest. There are, services where the parents, get sponsored to go on holidays, to go for weekends away, get away package. There's always there. And lastly, I would like to give message to people who will see a child in public behaving differently from the way your own child is behaving, and giving them dirty looks. That child might have autism. That child might have social, interaction problems. That child might have some overwhelming sensory needs. Don't. In African churches, let's do more to support our colleagues, peers, friends, sisters that have got children with a disability, because they need to be part of that community. They need to be able to feel free in the church. They need to be able to come to church. Again, I don't work as a childminder, but people think I do in my church. When I go to church, the little I do, when I see children that are giving their moms maybe a bit of hard time, I go to them. I'll be like, come, give me your son or your daughter. I'll go to a playroom with a child. Let the mom have a rest. Why? The mom is always with the child, 2-4-7, all the time. If somebody can do that with her for 1 hour, 30 minutes, just for her to enjoy, not even the service, it will go a long way. It will help. I don't have time at all. But I remember I said to myself, 2022, I'm going to give more. I'm going to help more. So I am in a support group, like I said. So I said to a friend, somebody messaged me, so is depressed. I called her, how are you? Oh, I'm good. I said, can I have your address? She's thinking, who is this woman? I said, I would like to have your address. Well, nobody comes to my house. Well, I want to come to your house. I went to the house, and the son, for the first time, is seeing a visitor, didn't know how to even cope. He was like, Mom was like, he's going to pull your wig. I said, don't worry, I'll pull my wig before he pulls it. So when I removed my wig, he was like, wow. You know, that in itself broke that barrier. He was close to me, you know, and I said, let's go to the park. And the mom, I said, just sit down. I just want you to be here because you really don't know me. We were at the park, and the mom said to me, she said, Rakel, thank you. That is the first time I've had a selfie in over 2 years. She sat down and took her picture. People are going through a lot. And this person is a hard-working mom. In 2 years, she's not had a selfie. Me, every night I'm having a selfie. I'll do this.
Something so little, but very important.
These things we take for granted. And I said, you know, if I can do more, I will. If all I can do, I don't know, maybe one Sunday in a month, go and help somebody. And if you can do the same, if you know of a friend that's got a child and she's struggling, when she tells you she's okay, say, I'm coming. Let me make you that cup of tea. Sit down, raise your leg up. You never know when she might never have had that time to herself. So yeah.
Rakel, honestly, it's been really, really great talking to you. I think we really need to have a further conversation at some point. Rakel, I know you've got a TikTok channel. Where can people find you on TikTok? What's the name of your TikTok channel?
Don't, because I don't know the name of my TikTok. I don't even know the thing.
All right, I will put Rakel's TikTok channel in the description box below. And I've also advised Rakel to start a YouTube channel. I think she would make a good YouTuber. She needs to, put that information out there for people that need it, and also make yourself approachable. So I think YouTube is a really good place. Guys, if you're getting value from this video, please don't forget to like, to share, and to subscribe to this channel. Rakel, it's been lovely seeing you again, and thanks for your time, Rakel.
Thank you ever so much. Have a good evening and good luck, everyone.
Cheers. Thanks, Rakel. Thank you.
Goodbye.